Our next panelist is Dr. Inger Burnett-Ziegler. Dr. Ziegler is a licensed clinical psychologist and an associate professor in the Department of Psychiatry and Behavioral Sciences in the Feinberg School of Medicine at Northwestern University. She's also a mindfulness trainer and certified yoga instructor. She received her undergraduate degree in psychology from Cornell University, her doctorate in clinical psychology from Northwestern University, and completed a postdoctoral fellowship at the University of Michigan. Dr. Burnett-Ziegler has over 15 years of experience providing psychological interventions to help clients with mood and anxiety disorders, stress management, interpersonal relationships, and wellness promotion. Dr. Ziegler is an advocate for eliminating mental illness stigma and assuring that all individuals have access to high-quality, evidence-based mental health care. Her research focuses on examining the factors associated with access and engagement and mental health service utilization, and using this data to develop, test, and implement acceptable and accessible evidence-based interventions in community-based setting. Dr. Burnett-Ziegler's op-eds have been featured in New York Times, Time Magazine, The Hill, and Chicago Tribune. She's an active contributor to the public discourse on mental health via her appearances on CNN, WGN-TV, and WTTW Chicago Tonight. She serves on the board of directors for several large healthcare nonprofits, including Heartland Alliance Health and Thresholds. Her forthcoming book, Nobody Knows the Trouble I've Seen, The Emotional Lives of Black Women, will be published March 2021. I'll be getting that book. She is a proud, lifelong Chicagoan. Ladies, please welcome Dr. Inger Burnett-Ziegler.
Thank you, Micah, for that wonderful introduction. Thank you to the Links for organizing this important conversation and inviting me to be a part of it. It's such an honor and a pleasure not only to join all of you, but to be on this panel with my colleagues and, more importantly, my friends, Dr. Clark and Dr. Pedersen. I want to start just by sharing with you that in my clinical practice, I primarily see Black women between the ages of 20 to 60 years old across the educational and income spectrum. One of the women that I recently saw in my practice came to me after her husband unexpectedly left after over 30 years of marriage, and she was telling me she hasn't felt the same since. Not only is she struggling with feeling lonely, she's worried about COVID and doesn't feel that her job is providing her with a safe environment to go to work. She's worried about everything that's going on in the world right now, and these worries are keeping her up at night. And her anxiety is becoming debilitating, such that her mind is racing. She's keyed up and on edge, just as Dr. Pedersen and Dr. Clark described as the symptoms of anxiety. She's distant from her family, and she doesn't feel like anyone in her family understands what she's going through or that she can talk with them. And she's angry about it. She's angry about her job, she's angry about her marriage, and she's angry that she's alone. Another person that I recently saw in my clinical practice is a 38-year-old single mom. She's in and out of work. Her father left home when she's a teenager, and since that time, she's felt rejected and kind of on the edge of her family and on the edge of relationships. And she comes into therapy because she finds herself chronically in one bad relationship after the other. She's trying to figure out how to break that cycle and to ultimately find herself in a healthy relationship. And then finally, another woman that I saw recently came in after her sister was violently killed by her partner. She's felt traumatized since that time, which was about over a year ago. She was raised by her grandmother. Neither one of her parents were around to help in her caregiving. And she's that woman Dr. Clark and Dr. Pedersen talked about, well, all of us are, but this one in particular, that strong Black woman that put herself through college, put herself through graduate school. She's the one that takes care of everyone in her family, the one that they're always going to and asking for help. And she comes to me because she's anxious about being perfect, about being there for everyone, about shouldering that burden of being the strong Black woman. These are some of the common reasons that people come to therapy: relationship issues, health issues, past trauma, family problems. And these issues are getting in the way of them being able to function day to day, to get by and be productive at work, to be present at home with either a partner or children, or to have strong, healthy relationships with family. We've talked about the stigma of mental health, particularly in the Black community. And when you think about that stigma, it can seem that at times that mental health is other people's problem. But we know that about 1 in 5 people will have a mental health problem at some time in the past 12 months, in the past year. And almost 50% will struggle with a mental health issue at some point in their lifetime. Doctors Clark and Peterson have talked about some of the symptoms of the most common mental health challenges, like depression and anxiety. Depression with people feeling sad, down, hopeless, worthless, low energy, even thinking about death or dying. People who are anxious, worrying all the time. Anxiety is something I certainly can relate to. And it wasn't really until I was in grad school that I realized that sense of panic and worry was anxiety, and that there was actually help for that you don't have to feel that way. That's something I see Black women talking about all the time, that need to be on, that need to be perfect, that need to show up. And the desire or belief that you have to manage everything and get everything done can lead to folks feeling anxious, racing thoughts, staying up at night, tightness in the tummy. And we know that women are more vulnerable to both depression and anxiety than men are. And stress plays a key role in that vulnerability. The American Psychological Association, the APA, indicated that the top stressors for people are money, work, the economy, family, relationships, personal health, housing, job stability, family health, and personal safety. We know that Black women have the added stressors of racism, more economic and employment challenges, and a greater or disproportionate vulnerability to trauma. That trauma including childhood trauma, physical, sexual abuse or neglect, intimate partner violence, or what we formerly called domestic violence, or exposure to community violence such as gun violence. And this year, not only to add on to our typical stressors, combined with the stressors that Black women face, we have the stress of COVID. More anxiety related to health, worries about contracting COVID. More Black people and Black women serving as essential workers, placing themselves at higher risk for exposure. More worries about job and housing security. Many folks not being able to work from home, and even those who can work from home, struggling to juggle working from home with also being fully available for virtual learning for their children. And as has been mentioned today, these stressors not only increase the likelihood of developing mental health challenges like depression or anxiety, but they also play a role in the physical body, leading to, as has been mentioned, obesity, diabetes, hypertension, cardiovascular outcomes, and the maternal outcomes that Dr. Clark mentioned: preterm birth, low birth weight, and miscarriage, which a lot of news attention has been given around the disproportionate rates among Black women. Not only does it contribute to these negative health outcomes, but these stressors actually, in fact, lower the life expectancy for Black women, where Black women have a life expectancy that's 3 years shorter than that of white women. We're managing us, we, the collective us, and how do we do it? By being strong. We all know the strong Black women. We probably are the strong Black women. Providers, caretakers, people that maybe in the past have suppressed our emotion. We don't allow ourselves to be vulnerable, although maybe after today, as Dr. Peterson described, the power in showing or talking about our struggles. Maybe we'll shift a little bit from that. We're resilient. We are people that bounce back, and we're proud of how we can bounce back. We kind of puff our chest out and say, yes, I can handle it, and we can, right? But that handling more than what is well for us, has consequences. And we know that strong Black women, one of the key characteristics of the strong Black woman is being firm in our faith. And that faith in God certainly has its mental health benefits, right? There's a substantial amount of research that shows that people who are more spiritual, people who pray more often, people who go to church more often have better mental health outcomes. But as Dr. Peterson mentioned, sometimes that faith in God, sometimes the strong Black woman, the belief that we have to be strong, can interfere with us getting the help that we need. We believe that because we have our faith in God, we shouldn't need mental health treatment. Because we're strong, we shouldn't feel the uncomfortable feelings of depression and anxiety, and in turn need mental health treatment. And as a psychologist, those should statements, I work with the folks that I see in my clinical practice to point those out, to point out those negative judgments, to point out those should statements that put us down, that make us feel bad, and interfere with us getting the help and the resources that we need. In addition, other barriers to mental health treatment can be cost, the availability of providers in our neighborhood, particularly if you're looking for a Black provider, location, childcare, time, you name it. If you're unsure about getting mental health treatment, we can find all the barriers in the world. And then stigma, or those negative attitudes and beliefs. More specifically, some of the things I hear people say is, I just don't need it. As a researcher that works in communities to help people to identify their own mental health need, to identify the signs that maybe you need some extra level of help. And I use screening tools, right? To say, okay, these are the signs and symptoms of depression. These are an indicator that maybe you need extra help. And even people that screen high will say, I don't need it, I'm fine. The problem will get better on its own, it'll go away. I can manage it. Therapy is not going to be effective. What are they going to do with my information? Right? Worried about the shame, the stigma, the judgment, not only from family, but from the providers themselves. So I so appreciate the tools that have been offered today. I'm going to borrow that toolkit that Dr. Peterson talked about and use that in my conversations with folks. When people come to see me in therapy, I first congratulate them for just having made it there, right? For taking the time, for carving out the space for just themselves. Because we know that as Black women, we often do everything for everybody else and sacrifice ourselves. So if nothing else, when people come to therapy, they've saved an hour to think about themselves, to focus on themselves. And I try and hold space for them without judgment, with compassion and care. And then we start the process of exploring the root of their suffering, that depression or that anxiety. Maybe it's from a trauma, past or recent. Maybe it's from this idea of, I often hear kind of, what am I doing with my life right now? Seeking for a sense of purpose. Maybe it's feeling lonely, that nobody else understands what you're going through. Whatever it is, we work together to explore the root of that pain. And then as a therapist, I work with people to help untangle those unhealthy thoughts, those woulda, shoulda, couldas, the put downs, the behaviors that keep them stuck in a space of not thriving, as Dr. Peterson mentioned. So often we don't even realize how what I call in therapy the negative self-talk. Right? And I point out, sometimes we are more kind and compassionate in our conversations with our friends and loved ones than in the ways that we talk to ourselves. And so one of my asks for you today is to start to pay attention to how you talk to yourself. Bring awareness to the ways that you might be able to offer yourself loving kindness, gratitude, forgiveness, and let go of those negative thoughts that can contribute to the suffering. In therapy, the first step is awareness, and the conversations that we're having today are a critical part of that. A critical part of developing awareness about how you're feeling on a day-to-day basis. Developing awareness about how those emotions not only impact your mind, but your body. Developing awareness about what's keeping you stuck and maybe where you can get help. What are the available tools for help? Maybe it's your family, maybe it's therapy, maybe it's a physician, what have you. And then using the help that's available to you. I'm so honored to be here today. I'm so grateful for the links, and I'm so grateful, that we have created the space for this important conversation. Thank you so much.
Dr. Ziegler, thank you so much. Thank you all to our panelists. If you heard what she said, that Black women have a lower life expectancy 3 years lower than whites, you need to make a change. There's a common thread going through all of this that you heard from these ladies, these fabulous, distinguished, and well-educated ladies. Strong Black women. We're all strong Black women, but there is a power in showing your struggles. There is a power in reaching out for help to continue. We know we're strong. Our mothers were strong. Their mothers were stronger. And you go back and go back. But we have to maintain that strength. And in order to maintain that strength, especially now during COVID, because believe me, there are a lot of challenges out there. And on top of everything else, which I said earlier, COVID is adding a little bit more to our stress. And stress can cause so many other problems that you heard these ladies talk about. And we are resilient, but there's a point where that resilience is going to give out. So you have to keep coding the resilience to make us even more resilient. And as you coding means seeking out help, seeking out support, recognizing, first of all, that you need that help. Because you have to first thing is to recognize that you need that help, to not ignore the symptoms, to understand that there are people who can help you, and forget the stigma. And we're going to talk a little bit more about how do we ignore the stigma that has been in our society for so many years.